Front and Center. Front and Center. A focus on important and significant developments affecting the lives of Filipinos, not only in the Philippines, but also those living and working around the world. Join us in Front and Center. Front and Center. Here on Radyo Pilipinas World Service.
Good morning to all of our listeners here on Radyo Pilipinas World Service. Welcome to another edition of Front and Center, where we put very significant issues affecting our country, the Philippines, as our program title says, Front and Center. On behalf of our colleague Jerome Toledo, I am your host for today, Steph Vicente, joining you all for a 30-minute worth of talk discussing important matters with our government officials, people from the private sector, or even members of the academe. As seen through our video live streaming, you may watch and listen to Front and Center through our Facebook page. Just search Radyo Pilipinas World Service. The same goes for our YouTube channel. Meanwhile, we also have an audio live streaming thanks to the Evox PBS receiver app. You may download the said application via Google Play Store if you are using an Android phone, or via App Store if you are using an iPhone. For today's edition of Front and Center, we will be talking about instilling awareness on HIV/AIDS via media. Just for everyone's information, here are the globally known key facts on HIV/AIDS being shared by the World Health Organization, or WHO. First, HIV remains a major global public health issue, having claimed an estimated 44.1 million lives to date. Transmission is ongoing in all countries globally. Second, there were an estimated 40.8 million people living with HIV at the end of the year 2024, 65% of whom are in the WHO African region. Next, in 2024, an estimated 630,000 people died from HIV-related causes, and an estimated 1.3 million people acquired HIV. There is also no cure for HIV infection. However, with access to effective HIV prevention, diagnosis, treatment, and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. WHO, the Global Fund, and UNAIDS all have global HIV strategies that are aligned with the SDG target 3.3 of ending the HIV epidemic by the year 2030. By 2025, 90% of all people living with HIV should have a diagnosis, 95% of whom should be taking life-saving antiretroviral treatment, and 95% of people living with HIV on treatment should achieve a suppressed viral load for the benefit of the person's health and for reducing onward HIV transmission. And in 2024, these percentages were 87%, 89%, and 94% respectively. And lastly, for the global key facts, in 2024, of all people living with HIV, 87% knew their status, 77% were receiving antiretroviral therapy, and 73% had suppressed viral loads. Now we're going to the Philippine statistics. In a joint news release published by WHO, it was said that the Philippines has the fastest growing number of HIV cases in the Asia-Pacific region. Every day this year, at least 57 Filipinos have found out they have HIV. The number of new HIV cases went up by 550% from 4,400 in 2010 to 29,600 in 2024. Around 252,800 Filipinos are estimated to be living with HIV this year, 2025. In March 2025, about 139,610 Filipinos, or 55% of the estimated total, have been diagnosed and are living with HIV, but only 92,712 of them, or 66% of those diagnosed, are on life-saving antiretroviral therapy. Of those receiving ART, only 41,786 have been tested for HIV viral load to check how well the treatment is working, and 36,630, or 40% of those on treatment, have the viral load under control. In the first quarter of 2025, a third of newly diagnosed HIV cases are among young Filipinos aged 15 to 24 years. These young people will need to be on treatment for life. Now, there are stigma surrounding HIV/AIDS, which we will discuss with our resource person later on, and one of the ways that could break these misconceptions or stigma is continuous information dissemination so that the public could have awareness on what is really happening to our kababayans who have HIV/AIDS. The media remains a component to this information dissemination. However, there are instances that instead of creating awareness among the public, it is fear that is being instilled to them, which is why advocates urge the media to drop fear-driven narratives and embrace fact-based HIV reporting during the Visibility is Key media dialogue held last week. These advocates emphasize that HIV is not a death sentence because it is a manageable medical condition with available and free services, as mentioned earlier. To talk more about this, we are now being joined by Joint United Nations Program for HIV/AIDS, or UNAIDS Philippines Country Director, Dr. Louis Ocampo. Dr. Ocampo, welcome to Front and Center. This is Steph Vicente of Radyo Pilipinas World Service.
Good morning, Steph, and good morning to all your viewers. And thank you for having me this morning. And thank you for stating the facts of the HIV situation globally and what the situation is in the Philippines. And you are correct. The Philippines is now facing one of the fastest growing HIV epidemics in the Asia and the Pacific. And recently, the Department of Health has declared HIV as a national public health emergency, urging the president of the Philippines to sign an executive order to implement and scale up the HIV response, not only by the national government, but encouraging all local government, to step up so that we can reverse the trend that we are seeing right now. Yeah, thanks.
Yes, and Dr. Ocampo, thank you again for gracing our program today. This is my first question, since I've mentioned the main topic for this edition. What is the key role of the media, like, of course, yours truly, in instilling HIV/AIDS awareness among the Filipino public, since I just have mentioned that there is still stigma surrounding HIV/AIDS?
Right. I think one of the main factor for the still increasing number of cases in the Philippines, despite of decades-long advocacy and program implementation, stigma and discrimination still prevalent, and this hinders access to HIV services. So the media, as we all know, could play a critical role in shaping public understanding of HIV and AIDS. It can actually disseminate accurate information about transmission, prevention, and treatment, and at the same time, because they're talking about HIV in their platform, they can normalize conversations around HIV, thus reducing fear and stigma. Um, they can also highlight personal
Mm-mm.
stories of people living with HIV to humanize the issue. No, parang we have to put face behind those numbers. So we're just not talking about data. These are real people. And kaya gusto natin na we put faces in from these numbers, and the media can actually do that. It can also hold institutions accountable for gaps in services and policies. They can hold government, accountable, since it is the mandate of the government to provide services, not only just services, but quality services and institutionalized innovations that we have. So we can be at par with international standards. And ang dami ng pwedeng gawin, no, to
Mm-mm.
curb the epidemic. We have innovations. We have pre-exposure prophylaxis. This is a kind of drug that can be taken by a negative individual to protect himself from getting the virus, no? Lalo na kung that person is engaging in high-risk behavior,
Mm.
like unprotected sex, no, multiple sexual partners, injecting drugs. So those are the behaviors that are putting these people at risk, no. So maraming interventions. The other interventions now that we have is the concept of U equals U. This means undetectable is equal to untransmittable. So meaning, if you are a person with HIV and if you are taking your medications, we call it antiretroviral drugs, religiously, you will become undetectable, meaning the body will now suppress the virus to a point that it cannot be detected anymore. And if that happens, you cannot transmit the virus anymore to another person. So, treatment, this is where treatment also becomes a preventive strategy. So, ang dami na.
Mm.
In fact, in the country, the antiretroviral drugs are given for free. No?
Mm.
So there should be no reason not to access those services. But like I mentioned, one of the major hindrance is the pervasive stigma and discrimination, which hinders our key populations to access these services. So in the Philippines, where stigma, remains high, media can be a powerful ally in promoting empathy, education, and at the same time action. No, so um, the media can be a powerful ally in the country's HIV response.
Mm-mm. Dr. Ocampo, meanwhile, since we have been discussing about the stigma and misconceptions, I've mentioned earlier as well that, of course, while we are spreading the factual information regarding HIV/AIDS, there are some instances that it is fear that is being instilled to the public through broadcasts or media content. So, what are the existing stigma or misconceptions surrounding HIV/AIDS in Philippine society that is being erroneously highlighted on mainstream media?
Yeah, so mainstream media sometimes unintentionally, reinforces harmful myths such as may nagsasabi pa rin, HIV is a punishment for immoral behavior. We're still hearing, saying people saying only sex workers or the LGBTQI community individuals are affected, which is not true because HIV does not recognize, any gender or any sex for that matter. It is based on the risk behavior. So it's a behavior risk, a risk behavior um, that we consider. No, so if you're not protecting yourself, having unprotected sex, then you're at risk regardless of your gender. Some media still say HIV is a death sentence, or if you're diagnosed with HIV, you're hopeless because you're going to die. This is not true because we already have a very effective treatment that we call antiretroviral drugs that I already mentioned. So this portrayals, no, fuel discrimination, and like I've said, discourage testing and accessing other HIV services, and can isolate those living with HIV. And in reality, anyone, like I've said, can be affected, and with treatment, people live with HIV can live a long, healthy, normal life. So parang these are the misconceptions that we still hear. So the other common mistake, I think, is the idea that it can only affect, certain groups, like LGBT, men who have sex with men, or people who are judged to have those risky behavior. Again, it's not true. This misconception actually fuels the discrimination further.
And now, Dr. Ocampo, how can we eliminate such stigma or misconception using media as well? Can you cite, if you have examples, proper terminologies that media people like yours truly could utilize in reporting or during discussions like this, centered on HIV/AIDS?
Yeah, so to eliminate stigma and for the media, to help us in ensuring that we reduce stigma and discrimination, at least, no, if not eliminated, we use respectful and accurate language, such as for people living with HIV and not HIV victims, no. So because these are people, and they are not defined by just a single disease, no. So the proper language, to refer to this persons, we can say people living with HIV, no. So we also say we could also say HIV positive, no, and not infected, because it connotes something negative. We also have to be cautious in using HIV and AIDS, because that's two different terms, no. So HIV stands for human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. Okay, so AIDS is the condition when the person infected with HIV has already a low, or yung kanyang immune system is already not functioning well, no. So that's why that person can already have, opportunistic infections, no. So yun yung AIDS, so totally different, and you can have HIV and not progress to AIDS, so kaya magkaiba siya. So we only use AIDS when medically diagnosed, no, so or appropriate. And we also avoid terms like AIDS virus, no, kasi hindi siya, so mali siya, or HIV carrier, no. And also, aside from the language, we should avoid sensationalism and focusing, and let's focus on facts, and consider human rights dun sa mga storytelling natin, no? And we should also feature diverse voices. So para hindi lang isa yung marinig natin, since particularly among youth and community leaders, kasi in the context of the epidemic in the Philippines, 1/3 of new infections are coming from the young people. So kailangan din natin na marinig yung mga boses ng ating mga kabataan. And we should also promote messages of hope and empowerment, no, not fear. So, and this is the reason why, together with partners, we developed a media guide, no, for HIV reporting. We call it empowering stories. To support ethical and empowering reporting, and so that our media practitioners can be of help in terms of reducing stigma and discrimination in the country.
It's nice to know that there is actually a set of guidelines for us to utilize when reporting or discussing regarding HIV/AIDS. And where could we find this set of guidelines?
Yeah, there's a link of the digital copy. We also provide, yung printed copies sa mga partners namin. You can actually request and we can send you copies. We also partnered with the PIA and also the regional PIA offices, particularly in Region 7, Region 6, and Region 9, no? So hopefully we can also in the future we can engage all regions, no, para mas mabilis natin scale up yung pagbibigay ng mga tamang information and guidance so sa ating mga media practitioners. So yun yung mga resources that we have developed. This is under the Visibility is Key campaign that we have launched in 2023 together with the Department of Health.
And speaking of that, of the Visibility is Key media campaign, which from which one of the editions was held last week. Why is this kind of event crucial when it comes to the fight against stigma and misinformation surrounding HIV/AIDS?
Like I've said, despite the more than 2 decades of awareness, and then we conducted a study. We call it the behavioral and serological survey, which was conducted by the Epidemiology Bureau of the Department of Health. The results are quite depressing, particularly in terms of assessing the level of knowledge of our young people. Only about 30% of them are aware of the prevention and transmission of HIV. So, and parang how can they protect themselves if they do not have the correct knowledge, no? So in terms of condom use, for example, only 1/3 of our respondents reported using condom consistently, and knowing that condom is one of the pillars of our preventive strategy, not only for HIV but also for other sexually transmitted infections and also pregnancy, right? Unwanted pregnancy. So ang baba ng condom use natin. And in that report, there's also some of them are still saying they cannot access, nahihiya sila mag-access ng condom, buying it, from stores or
Yes.
getting it from our health centers, despite na free dapat siya, no? So hindi nila ma-access because meron pa ring naka-attach na stigma, no, dun sa even sa condom, na usually they're being branded as promiscuous, you know, so kaya nahihiya sila. So this kind of misinformation and fueling stigma, gusto natin mawala. So that's why we launched this, we developed this guide and we launched this campaign, no? Para naman, and somehow we can educate not only our key populations but also the general population, kasi kung ang general population natin are also parang walang hindi alam, you know, so the stigma can rise, no, from them, no. So kaya we partnered with several government agency, community-led organizations, civil society, private, you know, sector, particularly media, you know, so that we can reach more communities, more people in our respective areas.
I'm just curious. Do you have also collaborations with universities or schools for this Visibility is Key campaign?
Yes, yes, no. So, meron kaming mga universities, like sa UP Los Baños is one of the partners. We're trying to include more schools and universities. Um, Quezon City is one of the champions in engaging schools, no? So marami ng mga universities and schools that would implement HIV services, no, including HIV education. Hopefully, nasa batas naman, Steph, you know, dun sa ating Republic Act 11166 or the HIV Prevention Act, no, of 2018, nakasaad doon na dapat lahat ng eskwelahan, no, lahat ng ating academic institutions should implement comprehensive sexuality education, which includes STI and HIV, you know. So unfortunately, the implementation is quite varied, no, across the country. So hopefully we can strengthen this program so that we can empower our young people. Kasi most of the time, hindi itinuturo sa tahanan o sa mga bahay, or hindi pinag-uusapan yung sex. Parang tuloy hindi nila alam kung paano poprotektahan yung sarili nila, and even how to say no. I mean, comprehensive sexuality education is not just about sex. It's empowering our young people in making decisions, when to say no, when to say yes, and how to protect themselves and their partners. So yun yung laman ng comprehensive sexuality education. It's not teaching about the sexual act alone, So may misconception din around comprehensive sexuality education, and recently there's been it was kind of sensational in a way, because a lot of politicians are giving their opinion about comprehensive sexuality education, which are not true, no. So hopefully, kasi parang still prevention is better than a pound of cure, right? So gusto natin na, and we cannot reverse the trend if we will not strengthen our prevention efforts. For HIV, and dami, like I mentioned, we have condom, we have pre-exposure prophylaxis, and we also have testing, which is an entry point, either further prevention services or treatment, no. If it turns out to be negative, for example, and you are sexually active, you have options. You can use condom, or you can use the pre-exposure prophylaxis, or if you're diagnosed, if you're positive, then you can proceed immediately to treatment, no, and you can become undetectable, in span of months, few months, so that you cannot transmit the virus anymore.
Yes.
So maraming ongoing na collaboration with the Department of Health, local government units, universities, and local, napaka-importante ng role ng local government units natin, Steph, considering that we have a decentralized health system, and it's actually the mandate of the local government units, to establish programs and deliver services. So hopefully with that role, mapataas pa natin yung antas ng quality ng mga services na pinoprovide natin. At dapat kumpleto yung interventions available at the health centers natin.
And before I let you go, Dr. Ocampo, do you have a final message for our listeners and viewers of Front and Center?
Sa lahat ng mga nakikinig at nanonood ng iyong programa, Steph, I want to say HIV is not a death sentence. It is a health condition that can be managed with love, support, and science. It should be evidence-based. And let's break the silence and to end stigma and build a future where no one is left behind. So I encourage everyone to get tested, get treated, and get informed. Because I believe, if all of us will play a role, na lahat po tayo may role I believe that together we can end AIDS in our lifetime. Again, HIV is preventable and treatable, and with early diagnosis and consistent treatment, people living with HIV can lead a full and healthy, normal lives. So I hope marami tayong natutunan this morning, and my only request is for us, who listen this today, to share it with your family, with your friends, with your schoolmates, workmates, para po mas madaming matutunan kung ano ba talaga yung sitwasyon ng HIV at kung paano natin mapuputol ang stigma at paano natin we can end HIV soon, no? Perhaps in the next 5 years, pagbalik natin dito sa same show, Steph, magaganda na yung ating share na information. Thank you.
Yes, and we are very optimistic that would happen. With that, thank you again, Dr. Ocampo, for giving us time for this very important and meaningful discussion.
Thank you. Bye-bye.
And we were just joined by Joint United Nations Program for HIV/AIDS, or UNAIDS Philippines Country Director, Dr. Louis Ocampo. And that ends today's edition of Front and Center. We would like to thank our production and technical staff who made this program possible. And thank you as well to our station manager, Mr. Ray Sampang. Until the next episode of Front and Center, on behalf of Jerome Toledo, this has been your host, Steph Vicente. Good day and stay safe, everyone.
You have just heard and watched Front and Center. Front and Center. Join us again for another edition here on Radyo Pilipinas World Service. Front and Center.